Hi, my name's Harry and I'm a medical student at the University of Oxford. Today I'm going to be talking you through my top tips for the UCAT. So as you all know, the UCAT is an admission exam required by the majority of UK medical and dental schools. Applicants will take this test in the summer before applying to medical school. It is an online exam with 5 sections. These are verbal reasoning, quantitative reasoning, abstract reasoning, decision making, and situational judgment. This is a time-pressured exam with less than a minute for each question. The overall limit is 2 hours. Each section is scored from 300 to 900 and this is combined to give an overall score. There is no negative marking, so it is always best to pick an answer than to leave a question blank. Different medical schools will have different cut-offs for invitation to interview. Some are high and some are low, so if you get a good score, applying to a medical school with a high cut-off will be beneficial to your application, and vice versa for a low score. So we will now go through the different sections. Firstly, verbal reasoning. This is essentially a written comprehension test. It assesses your ability to read a passage, interpret information, and judge whether conclusions can be drawn. You have 21 minutes to answer 44 questions, so this gives you about 30 seconds per question. You'll be asked whether a statement given is true or false based on the information in the passage, or asked to complete statements from the information given in the passage. So some helpful strategies include spotting common tricks, such as the spreading out of the information you need or phrasing it differently, so be on the lookout for synonyms within the text. Identifying mitigating or contradictory terms. For example, a question may ask about all of something when the text references only most but not all of something. And finally, you should skim the text and scan for keywords to help limit the amount of time it takes you to answer each question. Secondly, quantitative reasoning. This section uses GCSE maths to critically analyse data sets. There are 36 questions with a 25-minute time limit, so about 40 seconds per question. Questions can involve tables, graphs, geometry, percentages, ratios, or areas and volumes. So make sure you have mastered the skills from GCSE courses or the equivalent course you might have taken, and practice questions and also sticking to time, as this section can be very time pressured. Abstract reasoning. This section assesses your ability to spot patterns amongst shapes and ignore irrelevant material. You must quickly generate and evaluate hypotheses. You have 50 questions to answer in 12 minutes, so this is a very time-pressured section. In some questions, you'll be presented with 2 sets of shapes, set A and set B, and then 5 test shapes. You must then decide whether each shape sits into set A, set B, or neither. In other types of question, you will be provided with a sequence of shapes and asked to pick the next shape that would follow in the sequence from the options given. So to identify patterns given, you should firstly ignore the test shape or the options given, look at the simplest box in set A or set B, and formulate a hypothesis for the pattern. Test this against the other shapes in the set and series and see if this matches. You may have to go back and suggest a new hypothesis and evaluate it again, and then see if the test shape matches into set A or set B. In answering the sequence types of questions, you should look for what changes between each box and then apply that to the final box to get to the correct answer. The pattern changes can be involving size, shape, colour, direction, orientation, angles, and areas. So remember to test all of these domains in generating your hypotheses. Decision making. This assesses your ability to use logic and reasoning to solve problems presented as text or data. This is similar to information in verbal reasoning or quantitative reasoning. You have 29 questions that need to be answered in 31 minutes, and there are 2 main types of question. Firstly, multiple choice style questions. You have 4 answer options and only 1 is correct, or there'll be yes/no statements, and you must say whether an answer is true or false, whether a conclusion follows or does not. So the important skills to learn are how to recognize assumptions, how to spot strong and weak arguments, techniques for single parameter and multi-parameter puzzles, so logical guesses, how to identify syllogism and draw conclusions, understanding and approaching Venn diagrams, how to apply conditional probability and independent probability, and the application of other mathematical skills. Decision making very much builds on the skills of verbal reasoning and quantitative reasoning. And so the final section is situational judgment. This assesses personal skills and the ability to make the correct decisions in given scenarios. It doesn't assess your academic ability, but rather assesses your integrity, perspective, and ethical reasoning. You'll have 26 minutes to answer 66 questions, so 23 seconds per question. And there are two styles of question. Firstly, appropriateness. You will need to rate how appropriate a given response is in a given situation. And secondly, importance. You will need to rate how important a given factor is in a scenario. Unlike the other sections, this section is not scored from 300 to 900. It's instead given as a band from band 1 to 4, where band 1 is the highest and band 4 is the lowest. Band 1 and band 2 are considered the best scores. The answer you select must fit within GMC guidelines, so it's not necessarily what you might do personally in that situation. And you should be able to identify which attributes are being looked for and assessed. For example, if professionalism is being assessed, this will rank highly in terms of importance. Other important factors are patient safety, integrity, and confidentiality. So these will be my top tips for the UCAT. I hope this has been helpful. If you have any questions, please contact Oxbridge Solutions.